nanoparticles can be utilized for cancer diagnosis and therapy as well. Nanoparticles like cadmium selenide quantum dots, they glow when exposed to ultraviolet light. And this has been utilized to in a way diagnose the presence of tumor in the human body. When cadmium selenide is injected, they seep into cancer tumors. The surgeon can then see the glowing tumor when this is exposed to UV light. This is normally utilized as a guide for more accurate tumor removal before the surgery is done, because this helps you identify the exact location of the tumor. When cancer is diagnosed in a person, the aim of the therapy is to target the medication towards the cancer cells only, so that the healthy cells, they are not affected. For this, identifying the correct location of tumor is very, very important. We need advanced imaging techniques to do so, and nanotechnology is helping us to identify the exact location of the tumor so that the treatment can be localized to that area only, without affecting the other healthy cells of the body. There are a lot of sensor test chips which have been developed in order to detect biomarkers which are left by cancer cells. There are several proteins and chemicals which are expressed only by cancerous cells, and these biomarkers can be sensed using nanoparticle-based biosensors to identify cancer in a specific individual. Especially, there are several companies which are trying to identify biomarkers in human fluid like blood, serum, plasma, urine to identify if a person is expressing any of the cancerous biomarkers in this body fluid, which can help in early detection and diagnosis of cancer. This detection can be done using biosensors which are developed using nanoparticles. You can also have nanoshells which can be targeted towards cancerous cells by conjugating them with antibodies. These nanoshells will exactly go to the cancerous cells and bind because of the antibodies which are specific to the cancerous markers. Once they bind to these cancerous cells and move into the cancerous cells, you can irradiate this region using infrared light or infrared laser. Because the moment you expose this region to infrared laser, the nanoshells will get activated and they will start generating heat. This heat is enough to kill the cancerous cells. And obviously, this technique will not harm the healthy cells because you had coated the nanoshells with antibodies which are specific only to the cancerous cells. So they cannot go and bind to the normal cells at all. Similarly, you could also make use of nanoparticles which have anti-cancer drugs loaded in them. Normally, you know what happens? Cancerous cells, they become resistant to the anti-cancer drugs. They don't take the cancer drugs. So now these cancer drugs could be sent in disguise inside the nanoparticles. So you're loading the nanoparticles with the drugs and you're trying to deliver them specifically to the cancerous cells. How you can do that? So there is Baker's vitamin-laden dendrimers. So James Baker, who was a scientist at University of Michigan, he discovered a highly efficient and successful way of delivering the cancer treatment drugs. Now, how did he do this? He developed a dendrimer. This molecule has over 100 hooks over it, which allow it to attach to the cells in the body. Folic acid is a vitamin which is received by the cells in the body, and it is easily attached to these few hooks in the dendrimer. Now, what will this do? Please understand that cancerous cells, they are hungry for folic acid. So these dendrimers will specifically go and bind to these cancerous cells because of presence of folic acid. And these nanoparticles, these dendrimers, are actually loaded with cancerous drugs inside them. So the moment nanoparticles, these dendrimers move into the cancerous cells, the drug is going to be unloaded. And what will happen? These drugs will now be able to act on the cancerous cells, and specifically the cancerous cells would die. Now you would say that, sir, even normal cells would need folic acid. Then why would these dendrimers be taken only by cancerous cells? So please understand that the receptors which recognize folic acid are much higher in concentration on cancerous cells than on the healthy cells. Because cancerous cells want more and more amount of folic acid, they have generated a lot of receptors to recognize them on their surface. So the probability of these dendrimers being taken up by cancerous cells is much higher than its probability of being taken up by the normal cells of your system. There are several such techniques which have been developed, wherein flesh welder gold nanoshells have been made. Okay, there are also different kinds of techniques which have been, or devices which have been made, which we will speak about in our next video.